Coverage you can count on begins with a renewed push at the Georgia Capitol to expand health care access in Georgia and make it more affordable. Atlanta Bureau Chief Archit Seshadri reports.
Nonprofit organizations like Georgians for a Healthy Future say lawmakers must prioritize access, especially in rural parts of Georgia, by hiring more mental health counselors to tackle the mental health challenges that the Peach State is facing, as well as provide incentives for doctors and nurses and those students to practice and work in rural parts of Georgia.
Georgia has a huge issue with access to care in rural parts of the state, including rural hospitals closing service lines like labor and delivery units, and hospitals just struggling to keep their doors open.
Advocates say recent federal policy changes are making healthcare less affordable in Georgia after enhanced premium tax credits expired last year.
The state could invest more money into that and revamp it a little bit, which will have a little bit of an impact. And on a larger scale, the state could decide to invest money directly, essentially in its own subsidies, to bring down the cost of health insurance for Georgians enrolled in Georgia Access. So there's a few different ways the state could go about it, but there's other states with state-based marketplaces that have done the same thing.
Those credits, part of the Affordable Care Act, help lower insurance costs, and without them, thousands of Georgians are paying more for health coverage or even going without insurance.
Georgia has one of the highest uninsured rates in the country. Part of that is because we've not expanded Medicaid, and part of that is it is difficult to enroll in state-run health insurance programs. Those are state solutions that will give people better access to doctors, preventive care that will keep hospital doors open, lowering uncompensated costs.
Policy experts say both the state and federal government have options, including restoring subsidies, expanding Medicaid, and investing in state-funded programs to lower costs. They're urging state lawmakers to boost healthcare funding to support rural hospitals, address staff shortages, and improve access statewide. Reporting at the Georgia State Capitol, Archit Seshadri, Atlanta Bureau Chief.